Despite massive efforts by governments at all levels in Nigeria to communicate the benefits of vaccination and deliver vaccines safely and effectively to the citizens, there is rising cases and casualties from COVID-19. The situation, many say, is attributable to hesitancy about the COVID-19 vaccination due to strong anti-vaccination virus and leaves much to be desired. It is against this backdrop that a focus on Panorama from Port Harcourt Network Center is emphasizing the need for personal and collective responsibility to contain the pandemic. I am Jenny Basi. Thanks for joining us. President Muhammadu Buhari has made a strong case for the striking health workers in the country to return to their duty posts, saying the lives of the citizens that could be lost or damaged as a result of their actions are precious enough to be worth opting for peaceful resolution of differences. Granting audience to the executive members of the Nigerian Medical Association, the president insists that beyond fighting for their welfare, medical personnel must also have a sense of responsibility for national stability. State House correspondent Adamu Sambo has the details.
Speaking directly to the striking doctors now, I must say that embarking on an industrial action at this time, when Nigerians need you most, is definitely not the best action to take, no matter the grievances.
President Muhammadu Buhari says he is not unaware of the several prolonged meetings held between the government team and representatives of the striking doctors. He, however, maintains that the commitment of his administration towards finding durable solutions to all outstanding issues cannot be in doubt.
This administration has a good track record of paying all debts owed to government workers, pensioners, and the contractors. And we have even revisited debts left by past administrations once due verifications is done. I can assure you, therefore, that debts genuinely owed health workers will be settled.
The president says the cause of the COVID-19 pandemic in Nigeria is not entirely clear, especially with the third wave adding to public anxiety about health security. Preparations, he however explains, must be made by government to respond as each situation demands, and the role of the medical professionals is critical.
I request that the agreement reached in the meetings on the 20th and 21st August as captured in the MOU, which I have seen be rigorously implemented. I assure you of federal government's firm support to enable full performance and to stop any further disruption of services in our health system, especially in the period of COVID-19 pandemic. To this end, I shall establish a mechanism to continuously monitor all issues in the sector and get all our commitments implemented without the need for any further strike actions.
President Buhari described as pleasing the role the Nigerian Medical Association has been playing with regards to the ongoing industrial action by resident doctors, the separation of conjoined twins, as well as the valiant efforts in handling the COVID-19 pandemic, which earned the country global recognition. The national president, Nigerian Medical Association, Professor Innocent Uja, had earlier appreciated the president for the giant strides recorded by his administration in the health sector, as well as the appointment of their members into key government positions.
We wish to assure you that the Nigerian Medical Association, consisting of medical and data practitioners of Nigeria, will continue to work with you and partner with your administration's quest to improve the health of Nigerians. This is our promise. This is our commitment.
During the visit, the Nigerian Medical Association made some observations and suggestions for effective implementation of the roadmap towards achieving better healthcare delivery in Nigeria. From the State House, Adamu Sambo, NTA News.
Of September 2021, 466 new cases of COVID-19 were recorded in Nigeria. Until date, 198,239 cases have been confirmed, 185,780 cases discharged, and 2,588 deaths have been recorded. The 466 new cases are reported from 13 states, and they include Lagos 134, Rivers 82, Edo 69, Gombe 39, FCT 32, Kaduna 21, Plateau 20, Benue 19, Kwara 17, Delta 16, Akwa Ibom 10, Bayelsa 5, and Kano 2 cases. Mixed reactions have continued to trail the recent statement by the Rivers State Governor Nyesom Wike on a possible lockdown if the COVID-19 safety protocols are not being observed in the state. Nkiru Onyejesi, who went to town to get the reactions of residents, completes this story.
The outbreak of COVID-19 in 2020 compelled the federal government to enforce a total lockdown across the country to curtail the spread of the virus, which was a success as Nigeria was among countries that recorded minimal cases and deaths associated with the pandemic. However, with the Delta variant emergence and the upsurge of COVID-19 in the country, the federal and River State government have threatened to impose severe restrictive measures in the wake of the upsurge in cases.
The vaccinations are saving lives here and across the world, and those refusing to take the vaccines for non-certified medical reasons should know that they are endangering the rest of the citizens.
Fear, doubts, and lack of awareness are some reasons given by residents on why people are not complying with the COVID-19 safety measures.
But I believe and I also know that the COVID-19 is a reality in one way.
Personally, the government are not taking it seriously, because if there are penalty to why not wearing face masks, at least people will take it serious.
They gave me here, but I have not felt anything apart from small heaviness the first day. And after that, I'm now okay.
I've taken my jab and I want to say that the vaccine is safe.
I feel it doesn't really exist in Nigeria. If at all it will exist, it's not that much, maybe in other countries.
The belief that COVID-19 is not real and that the vaccine is dangerous to the health are reasons given by most residents of Port Harcourt on why they are not adhering to the COVID-19 protocols. In Port Harcourt, Nkiru Onyejesi, NTA News.
And in the studio to throw more light on this and why people should take responsibility is a consultant neuropsychiatrist, University of Port Harcourt Teaching Hospital, Professor Prince Will Stanley. It is my pleasure to have you on the program.
Thank you for having me.
Yes, sir, you just heard the report where people still have doubts. It is surprising that some Nigerians, quite a number of Nigerians are still having doubts over coronavirus and even the vaccine. Why do they still have these doubts?
Thank you very much. We know essentially that man is a suspicious animal, or let's say man is suspicious by nature. But that of Africans appears to be highly exaggerated. And coming back to Nigeria, it appears we love so much of rumors and folk tales that people cannot come out willingly to embrace the truth. Unfortunately, what used to be numbers have become people that we know.
Yes.
And today you see either a member in your colleague in the office, or somebody who shares a market space with you, or even in the neighborhood where one resides. It is quite alarming. And let me also give credit to the people, because during the first phase of vaccination, there was a lot of doubt. But I can tell you today that this second phase that started, all vaccination centers are just a beehive of activities, showing that people are beginning to respond. I also want to look at the laxity based on persons who know, who should be able to inform others. Like in marketplaces, it should become a law, but unfortunately too, people drag this so-called human rights to a very unfortunate level that could be harmful to the public.
Okay, so let's look at the method of transmission.
Yes.
What are the methods of transmission?
The methods of transmission, which you know from time, it's either aerosol means that if somebody coughs or sneezes, that the person within a level of about 1.5 feet or 2 meters can get it. And that's the essence of social distancing. And also the possibility of you making sure if it has come close to you, you have your face mask on, or even hand sanitizing or washing regularly under the running tap to ensure that the virus is not by any means taken into any of the frontal orifices, either through your eyes, the nostrils, or the mouth.
Okay, now you've identified rules to follow.
Yes.
But unfortunately, there appears to be a link of to misinformation, as some believe that natural remedies, alternative to medicines, are safer than even the vaccine. How is that?
That's a fallacy. And unfortunately, I have told you that we so much believe in either this online unverified news or information appears to be the scourge of the nation, even now that we have this pandemic. As we speak, there is the new mutation of the virus, and it's devastating. You heard of the Delta variant coming from India. And people should be aware, and I will say that at the level of medical personnel, there is a need to improve the capacity for medical personnel in terms of more staff and more training for the doctors, for the pharmacists, for the nurses, for the medical lab scientists, and also give them the reassurance that the country cares for its citizenry. Now, unfortunately, at the level of our primary health care, there is a collapse. Because here you can have what we call community health officers who will be so much engaged to go from home to home, from houses to houses, from hamlets to hamlets, and bring the information to the people, both the old, the young, the poor, and the rich, of the need to take these vaccines. Because it is real that the COVID-19 is extending its virulence and also causing so much deaths. Okay. We strongly believe that when enough advocacy, information, and education is given, people will willingly submit. And I want to say this, there's nothing wrong with herbal medication, but unfortunately it has great limitation because it has not been tested and found worthy by any scientific means. So if you are submitting your life to such, that simply means that you are submitting your own life and future to uncertainty, which may be quite grave and grievous. Okay. So we encourage persons to go to the nearest vaccination center and have these vaccines, so that we can live well and have the liberty to move from one point to the other
Okay. Now, World Health Organization had talked about countries stepping up their surveillance.
Yes.
Now, there are those in the rural areas. How can medical personnel assess these ones?
It's quite easy, but I've told you that our primary health care is quite comatose and has actually not been functional. Because if it is functional, that question would not be needful. Yes, I sincerely believe that the moment we activate the primary health care activity to the level it used to be in the days of Professor Ransom Kuti, we will go back to be who we are, because we have persons who have been very well trained, and what we need is an enlargement of the population of health workers who are properly well endowed and properly also remunerated.
Yes.
That is giving them some incentives that will make them go down to the rural areas and begin to carry the gospel of vaccination that is real for this safety of our people.
Thank you so much, Professor. Thank you. Well, we've been talking to Professor Prince Will Stanley. He is a consultant neuropsychiatrist, University of Port Harcourt. We'll now pause for a break. Panorama continues shortly.
The vaccine offers hope for a safe country free of coronavirus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence. I similarly urge all eligible Nigerians to present themselves and be vaccinated in accordance with the order of priority already mapped out at the various authorized designated centers only.
You're welcome. Early knowledge of essentials of first aid and acquisition of basic medical skills can be a life-saving activity, especially in the face of uncertainties like intercommunal clashes, unsafe roads, increased violence, and other threatening conditions. This is the submission of concerned Nigerians and stakeholders on the significance of this year's theme of the World First Aid Day, which is Be a First Aid Hero at School and in your community. Maureen Leo Ajon reports.
According to research, almost 27% deaths occur due to a lack of medical attention. From the website of the Red Cross Society, many people across the globe get hurt and injured due to lack of timely medical attention, and in some serious cases, many people even lost lives. Findings also reveals that if an individual has the right knowledge of first aid, it will help in reduction of injuries and deaths, as well as the impact of disasters, calamities, and daily emergencies. But how many people have the right knowledge about the first aid treatment?
I was in secondary school during one of the subjects I was doing, so they train us.
Whenever I have any injury or maybe I feel feverish, I use first aid.
As the world marks this year's First Aid Day, stakeholders maintain that advocacy is important.
We need to enlighten more people, especially in schools. Also in our communities, we also need to enlighten people more and also let them see the need to acquire these skills.
World First Aid Day is celebrated as a campaign aimed at promoting the importance of first aid training and increasing its accessibility to save more lives in a crisis. In Calabar, Maureen Leo Ajob, NTA News.
The Court of Appeal sitting in Abuja has halted the Rivers State government from collecting value-added tax, VAT, until all legal disputes relating to the matter are resolved. The court ordered that the judgment of the State High Court, from which the state drew authorities to collect the tax, must not be implemented. Justice Haruna Simon Sanami, who issued the order in Abuja on Friday, also directed that the law passed by Rivers State House of Assembly and assented to by Governor Nyesom Wike must not be implemented. The appellate court held that since parties have submitted themselves to the authorities of the court for adjudication on the matter, both parties must not do anything that will destroy the subject matter of the appeal. The progress of work achieved so far at the Rumola and GRA flyover are eliciting commendation from residents across Port Harcourt. Yanukume Ololo, who visited the site, reports that work on GRA flyover is nearing completion.
Motorists and road users will soon heave a sigh of relief as the construction of Rumola and GRA flyover projects are nearing completion. So far, street lights have been mounted on Rumola and GRA flyovers. Part of the flyover has been painted, while finishing touches is ongoing at the GRA flyover. Residents commended Governor Wike for his infrastructural development in the state.
It's a very wonderful work. It's a very nice work. I'm impressed. Port Harcourt is like America.
This flyover, in one way or the other, is going to decongest the traffic situation we've been having.
And numerous projects going on around the River State. It's a welcome development.
The site supervisor speak on the level of work achieved so far.
As you can see now, we are now for the finishing touch of the work. If you can see now, the light pole is already mounted, and we are now laying the asphalt. That's the final touch. Wearing course by now.
The infrastructural development of the state is on course. In Port Harcourt, Yanukume Ulolo, NTA News.
For sports update, Samuel Johnson is our guide.
Players and officials of Nigeria's professional league champions, Aqua United, have assured Nigerians of victory as the team hosts Belouizdad of Algeria this Sunday in the first leg of preliminary rounds of this year's CAF Champions League.
You should come down, support and see a good football and come and support Aqua United to victory.
The boys are hungry. It's a do-or-die situation. We are condemned to win.
Nigeria's second representative in the competition, Rivers United, are in Tanzania to meet Young Africans Football Club. Still on football, the last Group B games in the Nigeria National League Super 8 to determine the two clubs that would be promoted to the Premier League slated for Saturday indicates that with 4 points in the kitty, Shooting Stars Sports Club, 3SC and Remo Stars have one leg in the MPFL before the kickoff of the final matches. In English Premier League, matches slated for Saturday include Crystal Palace versus Tottenham Hotspur. Arsenal will lock arms with Norwich City. Leicester City will play against Manchester City, while Chelsea will trade tackles with Aston Villa. In another development, the third phase of the Lagos Sports Summer Camp ended Friday at the Teslim Balogun Stadium, with over 360 children participating in the week-long event.
We've achieved the objectives. One is to bring children together to give them a mentorship guidance. Two, introduce them to various sports, especially most of them who hadn't done more than one sport before, just football.
The camp, put together by the Lagos State Sports Commission, was aimed at developing the talents of young ones by exposing them to sporting activities as well as vocational training. With Sports Update, Samuel Johnson, NTA News.
On Panorama from Port Harcourt Network Center, COVID-19 is real, so go for vaccination and let's join NTA in the fight against rape and rapists. Good afternoon.